As October is the month dedicated to breast cancer awareness and breast health, we have Dr. Aydah with us today, who is a consultant medical oncologist to educate us about metastatic breast cancer. Hi, Dr. Aydah, how are you?
I'm very good, thank you. Thank you for having me. I'm so excited to be here.
So to start our discussion, what is metastatic breast cancer and what is the prognosis?
So the breast tissue is formed of different kinds of cells. So if one of these cells, for some reason, became abnormal, these abnormal breast cells travel to different parts of the body, including different organs, most commonly in the bones, liver, lung, and less commonly to the brain. We call it metastatic breast cancer.
Okay, and what is the prognosis?
Although it is an incurable disease, but definitely we advanced our treatments, and there are a lot of patients who live for many, many years.
So since we're talking about patients being diagnosed, after being diagnosed, it may feel difficult to maintain a positive outlook. What is your advice on protecting the patient's well-being?
So I give the patient as much time to absorb the situation. You know, it's not wrong for them to ventilate it, to express their frustration, their sadness about it. But with time, and once we start them on treatment, they get better. The outlook sort of change, especially if they have a good support from their family, from their friends, you know, from the community.
And what are a few of the biggest misconceptions and myths about fighting breast cancer?
Many, actually. Cutting off sugar completely, you know, would that stop my cancer from growing? But there is no big evidence on that. You can definitely substitute natural, these artificial sugars with natural ones.
Like maybe have a lot of dates and just a healthy diet overall.
Honey, for example, these are all good sugar in moderation, of course.
And the next question is, how would you describe the medical treatment for metastatic breast cancer?
Now we have advancement in treatment, and a lot of these treatments come in the form of pills. How we treat the patient, they just take pills. They have fewer visits to the doctors as opposed to chemotherapy, and different types of cancer. Now we are shying more and more away from chemotherapy and moving toward these smart medications.
So according to you, what are the top preventative measures that someone can take?
If I would pick the most important ones, it would be maintaining healthy weight. The second thing will be limit alcohol, for example, because there is a study that says any amount of alcohol can increase the risk of breast cancer. Breastfeeding for those patients who are expecting, breastfeeding, the longer we do it, the better.
And patients with metastatic breast cancer are at a higher risk of developing severe symptoms from infectious diseases. If infected, what would be the immediate actions that they should take?
Of course, a lot of these therapies may impact the immune system and make it lower. Not necessarily the cancer will lower the immune system, but the medication they take nowadays, actually a lot of these medication does not impact the immune system. And once they have a fever, they have immediately to seek medical attention.
With your long-standing experience and knowledge, what message of hope would you give to people who have recently been diagnosed with metastatic breast cancer?
If you have metastatic breast cancer, it's okay, you can do this. Be strong, be hopeful, stay connected to your friends, family, and community.
All right, thank you so much, Dr. Aydah, for sharing all this information with us. This has given hope to many patients who have been diagnosed with metastatic breast cancer.
My pleasure, and thank you again for having me. I think this is a great opportunity to spread hope to the patients and the community.